the cats on Longstreet talk about adoptable cats. Dr. Worden founded the Cats on Longstreet, TCAL. If you want more information about the work that they do, go check out their booth over there. Lots of great information about how you can get involved and what they do. And a big part of what you do, Dr. Worden, is treating cats with FIP. So I think that's a great segue into your talk. So take it away.
Hey guys, how many of you know what FIP is? Right here. Yeah, okay. So as of 2019, FIP was universally fatal. Every cat who was infected or affected by it would die. In 2019, a pretty awesome research project was released that showed that a specific type of antiviral medication was effective in sequestering that virus long enough that the immune system can do its job. So that's what treatment is based on, and that's important to remember. Unlike this is ex-Benedict, he's very distressed because we put him back in the area. Anyway, forgive me. But the important thing to remember with FIP treatment is that unlike an antibiotic, most antibiotics, it's not killing the virus. It's inhibiting virus replication long enough that the cat's immune system, or the human's immune system in the case of COVID, can actually defeat the virus and recover from the condition, okay? These two cats here, because I think Benny's patience is probably going to run out pretty quick, both of these cats are FIP survivors, okay? Both of them came in very sick. He was on his last 10th of life. He burned through 8 3/4 or so of his lives before he came to us, and only weighed about 3 pounds. And he was this frame size, but he has been cured since then. And Benny came from a house where we ended up having 3 or 4. How many FIP cats came from that property? Do you remember? 5. Yeah, it was several. And that speaks to a couple of things. FIP proper is not contagious, but the precursor virus is highly contagious. Again, think norovirus on a cruise ship. Everybody goes down with that. And there is a genetic component. So the cats that we took from this property that ended up with FIP, they're all genetically related, right? So they have genetic commonalities in their immune system that allow them to become susceptible, okay? So if Victoria, if he does actually lose his mind, if we get booted back over there, he doesn't like to be told what to do because he's a cat, they're bigger. And both of these cats are actually up for adoption. If anybody's interested, please, like Benny, they'd like to have a nice big house to run around. He's slightly insane in a good way. So FIP starts out as this norovirus on a cruise ship, right? So feline enteric coronavirus. You are not going to eliminate that from the cat population. It is something that runs rampant, lasts through multi-cat households, so catteries if you're breeding, or if you just have more than one cat. It also blows through shelters, rescues, anywhere where there is more than one cat in any kind of space. It is a fecally shed organism, but again, norovirus on a cruise ship, it gets everywhere all the time, okay? Once a cat is infected with that virus, like all of the other viruses in its class, it will continue to mutate. And in some unlucky creatures, it's going to mutate in such a way that it changes the surface proteins, so it puts on camouflage. It gains the ability to hide from the immune system, but at the same time, it loses the ability to be transmitted directly from cat to cat in most cases, okay? If you spend too much time on Google, you may run across the Cyprus problem. There is a form of FIP in Cyprus that is being horizontally transmitted, meaning it is being transmitted from cat to cat. They've had tens of thousands of cases of FIP on the island of Cyprus. The good news is, for now, it has not left the island of Cyprus, but certainly we are monitoring for that and watching for evidence that FIP is being transmitted. But in most cases, that is not true. Okay? It cannot be transmitted. So if you have an FIP cat that's brought into your house, or one of your own cats develop FIP, that cat does not have to go on lockdown. That cat does not need to go in a crate for 84 days of treatment and 84 days of observation. That cat does not need to get locked in the bathroom. Unless, cat hair, occupational hazard. Unless you have other cats in the household that you're fostering that maybe are sick. Give me 1 second. CJ, can you return Benny to his assigned seat? He's having a connection. Yeah, he just occasionally we will isolate an FIP positive cat in a house, not because we're worried that they're going to get somebody else sick, but because their immune system is being hammered into oblivion, and the last thing they need is to be exposed to a new set of kittens that came into a foster home, right? Or a new cat that came into a foster home that has some other kind of condition to challenge them further, okay? So that is one of my pet peeves when I get cats that are referred to me and other people have told them, you need to put them in a crate. No, you do need to watch their appetite, their attitude, their activity, and what's happening in the litter box. If you guys ever come to me for an appointment, that will get preached at you. Anytime you have a sick cat, attitude, appetite, activity, what's happening in the litter box. Those are the top 4. So you do need to know what's going on with your FIP cat. You need to make sure that it's not hiding in a closet or under a bed or in a box spring where you're not going to be able to find it. But you want to have a low stress environment. So it's going to stress Luigi or Benny out by putting them in a crate for 84 days. Don't do it, man. Don't do it. Let them do their own thing. Let them be a cat. Let them be comfortable. Let them be as low stress as possible. Okay? So once we find that we think a cat has FIP, it can be a real challenge to get a solid diagnosis. It's been a really interesting time to be a mostly cat practitioner and someone who's active in rescue, because we have had this huge pendulum swing from no one ever sees FIP, it doesn't exist, and no one recognizes it, to everything that comes in must have FIP. And currently we are more in the everything has FIP pendulum swing, and at some point hopefully it's going to rock back to middle. So I have been fortunate and unfortunate, both sides of that, to be on the front lines with the treatment of FIP. So back in 2019, I had a foster cat, still, her name is Fantasia. She came to me with central neurological FIP along with ocular FIP, so she was a head tilt still. She had a very high fever. She had uveitis in both eyes, so both eyes looked, the actual globe itself inside the eye looked bloodshot. You could see pus and what are called granulomas, little nodules on the surface of her iris on both sides. And she was super sick, and I took her home to be a hospice foster. And if you guys were in the last talk, that is the only foster fail I've ever had. Believe it or not. Okay? And that is saying a lot, because I have a lot of fosters. But I don't know that she counts, because she's still technically a hospice foster. Just accidentally happened to cross the treatment for FIP and ended up curing her. So now, instead of being a hospice foster for what I told my husband was 7 days, 10 days if God and the book get involved, 14 if everybody gets involved and the U.S. government can get its stuff together, now it's going to be 16, 18, 20 years. Because she's pretty much a normal cat. Right? And it took my husband 3 years to realize that. 3 years. 3 years later, he looks at me and he's like, why is that cat still here? And I was like, did you not listen to any of the conversations we had about this cool, earth-shaking, new development in the treatment of FIP? And he's like, no. So these cats will come in virtually expiring. We had a notification that we used a dirty word that starts with D that rhymes with lying yesterday, and in fact banned off some of our social platforms. So we're going to say expiration instead of that other word.
Deleting also works.
Deleting? Okay.
Deleting.
So we'll have cats that come in virtually expired frequently, and we start with aggressive symptomatic and supportive care. That first 48 to 72 hours is crucial. And then we get them started at the same time with GS, which is the street name for the medication that we use for FIP, for lack of a better word. And then if they survive that first 48 to 72 hours, the cure rate is very high. It's at least 80%. If we take out, eliminate that first 3 days of treatment, our cure rate is above 80% with a full course of treatment. If we do get a relapse, which does happen, but it's not often, we had, I want to say 15, I need to look at my spreadsheet, 15 out of over 500 cases that we have treated as part of my vet clinic and rescue. That's a super small number. And of those that relapse, we also have a very high cure rate. Okay? Now, some other new developments that have happened, things that we've learned, because we've been treating it at my clinic for so long, we're kind of on the very lonely place of being on the front edge of, oh shoot, this is happening. What do we do? How do we fix this? And I don't have very many people that I can reach out to and say, don't know what's going on. What do we do next? What do we try next? So we call it MacGyver medicine, where we just kind of, we literally fly by the seat of our pants trying to figure stuff out. And then we go back to, or I go back to, I have a Facebook Messenger group, believe it or not, that is a group of about 10 international veterinarians that have been, we've all been treating FIP together since 2019, 2020. And that is where all of the, in my opinion, the groundbreaking stuff happens, right? So, oh, Luigi. This is what he's like. Please, somebody adopt him. Give him a lap to sleep on. Clearly does not care. So within this group, we figured out pretty early, probably back in 2020, probably the first half of 2020, that the published doses of GS were not high enough. And since then, so initially it was you should treat them at 4 mg per kg once a day for wet. And I looked at that and said, so I started treating them at twice that, 8 mg per kg once a day for the wet form, which is considered the simpler form of FIP. And I think that's part of why we have such a have had such a high success rate from the beginning. Since then, over the last, almost 6 years now, the public recommendations keep getting adjusted up. So now, finally, 6 years later, 8 mg per kg is the starting point recommendations, which we've been doing. And I got yelled at actually by a lot of internists because they were like, you don't know what that's going to do. And I'm like, sure, I know it's going to help us kid. And then we'll figure out other stuff later, right? So that's one thing that's happened. So now the published recommendations for treatment for FIP are at least twice what they were initially. The second thing that we noticed, maybe it was probably about 3 years ago, we noticed that some of these cats just weren't responding like they should have, and decided that we were going to start dosing them twice a day. So instead of doing 8 mg per kg once a day, started doing 8 mg per kg twice a day, which is twice the dose. But I kept looking at that and I was like, I'm not sure that it's actually a twice the dose problem. I think it's the dose interval, we call that. And since then, now the researchers, there's a couple of big ones that are working on FIP studies. Since then, as of this year in January or February, at the big conferences, they released recommendations that say, you know what, we should probably be dosing these pain in the butt cats with twice a day GS because based on what we think is happening, call it pharmacokinetics, where the medication magic happens, where it goes into the cat, the body does magic with it and sends it places. So based on the pharmacokinetics in an individual cat, there are cats that once-a-day dosing does not maintain adequate blood levels of the medication. So as such, several years ago, we started moving any of our problem cats to twice a day, and maybe, it's probably been about a year ago now, I started doing almost all cats twice a day, but some pet parents were very resistant to that for obvious reasons. And now we do everybody twice a day. And I'm like, hey, look, there was something to that. It wasn't just all in my head. So that was cool. So we do that. We have discovered that. We also have come up with a protocol that's been adopted by all of the vets that I talk with for our severe neurological cats. So we get these severe neurological FIP cats that come in that will be having ongoing seizure activity. So we call them reentrant seizures, cluster seizures, or status epilepticus. They all interrelate. And it used to be that when those cats came in, they were instantly euthanized because the prognosis was absolutely just terrible. They could not help it. So what we do, we have a cat named Bolby who is adopted. Luigi's like, I think I've done named hell now. I'd like to go back to my third breakfast too. So we have a cat named Bolby that came in. His blood sugar was in the 20s when we finally got him to read. That is not compatible with continued existence. That's how we describe that. Had been having seizures for at least 24 hours straight, which in most cases would cause permanent brain damage in the cat, or he would expire from that. He was basically comatose. There was nothing happening upstairs. So we placed him in a catheter. We put call it a nose-hose nasogastric tube in. We started medication called mannitol or hypersonic, I can't remember which one we had at the time, to reduce brain swelling. We gave him whopping doses of steroids, which is another hot topic in FIP, to reduce the brain swelling and help with his blood sugar. We had dextrose, so sugar given IV to help with his blood sugar. And he got hammered into oblivion, literally, with seizure medications. And we put him in basically a medical coma, an induced coma, and he lived in an incubator for 2 days, 3 days, I can't remember now, it's been a few years now. And that is now the standard of care. So we give them super high doses of GS, we address the brain swelling, we address the seizures, we address the hypoglycemia, we provide them some nutritional support through the nose hose, the nasogastric tube. We keep them warm, we keep them comfortable, we let them take a good hard nap for a couple of days. And then once their brain has had a chance to reset, we gradually withdraw sedation, see what happens, and then go from there. Bully is now a very normal man cat who looks like a panther. He's big and black and beautiful, and I just adore him. He's fabulous. I was not sure he was going to make it. So that is, that's another kind of breakthrough that we've had in terms of how do we save these neuro cats. And up to today, whatever. If you go out to most emergency facilities and pretty much all general practitioners, if you take a severe neurological FIP cat in that has brainstem herniation, so they're on their side and can't stand up, or they're having ongoing seizure activity, they will tell you, they'll look at that and say the prognosis is grim. And I say, nope, it is not. Ignore that. Treat them aggressively, and most of the time they will be able to pull it out. The one thing that has come out internationally that we were seeing, and I kept going back to my support group and saying, hey, I have these kittens that are coming in, these cats that are coming in with what's called ileus, where their intestines aren't contracting anymore because they've been just that sick without water. That is the one very negative prognostic indicator that we have. Hang on 1 second. This is Kristen. She's going to be late for her own funeral. How's it going? So FIP treatment in our rescue is this person's fault. 100% her fault. She doesn't listen, it's definitely her fault. So ileus, the cat can come in with brainstem herniation and be incapable of standing up on their own. And if it hasn't been there for more than about 12 to 24 hours, we can usually save them, right? As long as the brainstem hasn't been squished out into the spinal cord long enough that the nerve tracts have been permanently torn. If they get torn, then they turn into Christopher Reeve. If they're not torn, right? If they're not torn, then they can regain function. So that is not a grim prognosis. That's I think I can work with this. But if they come in with ileus, we look at that and say, we're going to try. We're going to be really aggressive with this. But so far, I think we're still at overall 50% success with that? Probably about 50%. And the protocol that we use when I tell referring vets, it's just so weird to say that, because we don't have a referral facility. I'm just a general practitioner, right? We're just a vaccine clinic. We're just a day practice that does really weird stuff. So when I am talking to other referral facilities, which is so weird, and they call me for help, and I'm like, you need to give them ultra high doses of these medications. And they're like, that's 10 times what we're supposed to give them. And I am aware. Also, if you do not, you have a 0% chance of saving this cat's life. If you give them a heaping helping of these particular medications, you have a 50% chance of saving this cat's life. So it's a big deal. Anything else? Most cats are treated with oral medication at this point in time. For acquiring GS, that is a very sticky topic, and it can be very difficult to find reliable sources. The legal versions of GS actually take the publicly available, the approved tablets of boba from the UK or Canada, so that they would come in a fancy bottle that says boba something on it. And then the compounding pharmacies in the US have to take that tablet that has a coating and everything else, break it down, crush it up, and then reconstitute it into a liquid, a capsule, or a new tablet. And as a result, we are seeing problems with what we call bioavailability. So the 10 milligrams of the boba tablet is not equivalent to 10 milligrams of the compounded product in many cats. And that is a problem, okay? So until we actually get a licensed product that is truly manufactured in the United States, we have to be careful with the compounded versions that are out there. The other source that most people can find information on, there's 2 Facebook groups that have variable reliability and are victims to infighting and all kinds of politics and drama and other stuff. There's all kinds of tea with it. It's really annoying. I don't have time for that, not emotionally, not logistically, not at all. So the rescue has ways to help owners find reliable sources of medication that the rescue has used for 5 years. It's been the same with the manufacturer, right? For 5 years. Capsule form and injectable. And if you need injectable GS, any cat who is lateral, so they can't stand up, they're comatose, their guts aren't working, they can't digest, that's a cat that should probably be treated initially with injectable GS. And to get injectable GS, that is black market in the United States. There is no compounded form of that available yet. Okay? So if you need help with that, you can reach out to the rescue, and the rescue can probably provide you some contacts to some drug sources to try to find emergency injectable GS. But then all of our cats, unless they are absolutely averse to getting pilled or they fail to respond to one of the oral formulations, we start them on injectable and then move them over to oral as soon as possible. Okay. Remdesivir is the human COVID medication, is actually metabolized into GS. So remdesivir is a precursor drug, and you can use that, and referral facilities will script out human injectable remdesivir to use in cats. IV. It is. It's like, how many doses? It was $1,700 for one bottle, and that one bottle was 2 doses. So that is where people say it's going to cost $20,000 to treat a cat with FIP. That is when it costs $20,000 to treat a cat with FIP. It should not cost that much. Okay. And on average, the rescue gets discounted pricing because we're a rescue for the cats that we treat with FIP. And I want to say we're down to what, like $200-300 a cat for medication costs. It's probably $200 or $300 in medication costs per cat. Rescue pricing, which is about, I want to say it's about half of what a normal person would pay for the product it takes. And so most of the cost isn't the medication most of the time. It's actually the blood work and the exams and that first initial supportive care. If you have a critically ill cat with FIP, it is not weird to spend $2,000, $3,000, $4,000, $5,000 in that first 72 hours, particularly if they end up at one of the bigger referral facilities. In our rescue, when we get cats like that, they end up in the RV ICU at her house. So there's an RV that has incubators, several, and that's the RV ICU. So she has a number of syringe pumps and stuff, and she gets to play all night with beep, 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 beep. The beeping of her nightmare, she says. So anybody who works in human hospitals or veterinary medicine, we all have nightmares about the beeps. Where is the pump beeping? Why is it beeping again? Somebody shut it off. Anyway. All right, so what questions do you guys have? Yeah.
The twice-a-day dosing, is that the 8 mg per kg twice a day, or half of it in one and half of the other?
That's a good question. So the question is, the twice-a-day dosing, every 12-hour dosing of GS, is that 8 mg per kg twice a day, or is it split? And the answer is usually it's split. However, I am very heavy-handed with GS, always have been. So I tend to do, if I am going to split it, I tend to do 5 mg per kg twice a day. Also, that's going to depend a little bit to start. In our critically ill neurological patients, we do 10, 15, 20 mg per kg twice a day to get them going, which is a huge dose. So we know that. When we transition them to oral medications, the dosing is based on the capsule size. So, and that's true of any medication. So there's some art to the science. So it's going to be, well, I want this cat to get roughly 10 mg per kg twice a day. And then I go to my licensed technician, and I'm like, all right, I want this cat to get about 10 mg per kg twice a day. Go do your thing. And then they will figure out the capsule math and see what makes sense. So to get exactly 10 mg per kg, they end up needing 4 capsules a day. But if we give them 12, or just for example, if we round it up to 12 or 15 mg per kg, and then they only get 2 capsules a day, capsule math, we're going to do the 12 to 15 mg per kg because they're cats.
gonna puke it up anyway.
They don't usually pick it up. But my motto as a veterinarian and also as someone who runs a rescue that kind of sucker is to make sure that a cat is a cat doing cat things, right? So they're going to be eating, drinking, eating, pooping, playing, grooming, sitting in sunshine, being social, right? So a cat is a cat, a dog is a dog. They do actually treat dogs. I know it's crazy. And that the human, the pet parent, is sane, right? Do not make things so complicated that they lose their marbles. Able to pay the mortgage, which is also really important because homeless animals and humans don't do anybody any favors, and in possession of all of their appendages. So I don't want anybody getting bit, scratched, mauled, or ruin their relationship. And a lot of these cats come to us, like the ones that we take care of, a lot of the cats are that actually come from hoarding situations. So these are cats that are already emotionally and socially hindered, we'll say. So we have to be really careful with those guys. And if we have a cat where giving them injections twice a day is going to ruin our relationship with them, we are not going to do that. That is not in anyone's best interest. So. Kristen's over here saying candy. She says it also depends on the cat and which kind of FIP they have, which is absolutely true. When you get into the really high doses of GS, by really high, I mean like 30 mg per kg twice a day. That is generally considered the ceiling. That sometimes we end up splitting that where they will end up getting an injectable dose of 30 mg per kg at one of the times, and then we'll get an oral formulation at the other time to kind of maximize absorption and hopefully reduce the workload on the owner of the cat and not one relationship. There's parts of the science. I have had now 4 cats, that we've had to treat fairly long term with one of the ultra high ceiling doses at 30 to 35 mg per kg twice a day. The risk with that is that GS is removed from the body by being removed, not metabolized, but removed whole, intact by the kidneys. So there have been a couple of reports of cats that have developed kidney and bladder stones that are actually made of GS that has crystallized out of solution. And that has happened at the really high doses. It is very rare, but it absolutely can and does happen. But again, it's a calculated risk. Am I going to risk a bladder stone in a cat and save its life? Or am I just going to be like, there could be a side effect, but your cat's going to die, so let's just let him move on with his life. So it's... Oh yeah, that's a good point too. One of the other things that's happened lately, we've had 2 cats that have had bear badger. There's a family has 2 cats that look exactly the same. They both had FIP, infected both of their kidneys. They both had neurological signs. They happened within 6 months of each other, and their names are bear and badger. And it was really rude to do that to me because I have trouble with names as it is when they're too similar, names and numbers. My brain can't do that. So one of them, Bear or Badger, the second one, whichever one that was, and Looney, a completely unrelated cat who's a ragdoll, by the way, one of the top breeds for FIP. They both had absolutely bizarre side effects of FIP, where they became whole body painful, they became weak, incapable of standing up. And when I went to my little FIP support group, I was like, has anybody seen this? Has anybody heard of this? And they're all like, no. And then we stopped the medication in Bear or Badger, whichever one it was. We stopped the medication and she got progressively better after that. And for Looney, same thing. We stopped the medication and she got progressively better after that. So weird things happen. They're both still here. Hey, what's up?
Dr. Internet says that a cat can be treated in 40 days.
Dr. Google does say that some cats have been cured with treatment for half of the recommended course of treatment. So the current recommendation is 84 days of treatment, which works out to 12 weeks, and then 84 days of observation. That is based on the lifespan of the white blood cell that FIP invades and colonizes it, right? So that did not just happen. That 84 days was not just Dr. Peterson pulling that out of the posterior orifice. That was based on a scientific rationale. So if this virus can live 84 days, we want to provide viral suppression for the entire lifespan of those white blood cells to try to that cat the best opportunity at moving it. Okay? There have been several published cases now where a cat has only been treated for half that time, for 42 days, and they've gone on to cure. And we actually have one cat, her name is Lily, I think she's still alive, who, when we first started treating FIP, I want to say it was the middle of 2020, the owners decided after her 30-day recheck, she looked so good that they were going to stop the medication and never come back to see us. And when we checked in with them a year or so later, they were like, oh, she's fine, she's great. So we have seen a cat that has gone on to cure at 30 days, and we've also had cats that have been treated for shorties. I don't even collect the shorties. One of my, he has FIP, and his immune system is jacked, and this cat's relapsed 4 times. So he's actually been on FIP medication probably about half in his life. And we have 2 cats that are, they're always challenging each other to see who can be the biggest pain in their butt. They're both, knock on wood, they're both currently off treatment after their 4th relapse, and a substantial way through observation, and that is all I'm saying. I'm not saying anything else, because I'd like to have them come back for social visits next time. Any other questions, guys?
You just made reference to ragdolls being at higher risk. You made reference to ragdolls being at higher risk. Other breeds?
Absolutely. So the question is basically what breeds are at highest risk? There is a very strong genetic component, and that I cannot stress that enough. That's part of the reason why I am here today. If you start seeing FIP show up in your lines, you need to take a really close look at the genetics and try to figure out whether it's coming from the maternal side or the paternal side, and you probably need to start cutting down on your gene pools, because it is absolutely a genetic predisposition for it. And I can't tell you how many families we've had come in that the entire family has been hit with FIP, every single one of them. The top, say that? Litter mates, yeah, litter mates are a known risk factor, right? Because there is a strong genetic component, okay? The top breeds internationally right now, and this is, the top are going to be Maine Coon, Ragdoll, what's the other one? There's 3 big ones. Maine Coon, Ragdoll, and I can't think of what the other one is right this second, but it'll come to me. But then we also see it quite a bit in Burmese, Sphinx, and Shorehairs. Those are the top ones that we see. Yeah, and we have had a couple of like Scottish Folds as well. But there is absolutely cannot. Ragdolls in our area, huge problem. Huge problem. When I first started treating FIP, most of the cats that were referred to me for treatment, supportive care, that kind of thing, most of them are ragdolls if they were referred by others. That's changed some of the last year. That's a big difference.
How frequently does the virus, is there resistance developed to the medication?
That is an excellent question. I don't know. So the question is, how often or how frequently do we see resistance develop to GS? We do not know the answer. There is Dr. Serna out of Colorado. That is currently her pet project, is to look at the incidence of resistance to, in part, to GS, but also to EID. Does anybody here know what EID is? Full irregular beer, that one. There's some syllables mashed together. EID is another medication that we can use to treat FIP, and it is a human medication because it's one of the big ones that's used for COVID. The problem with it in humans is that because of how it acts, what stage of virus replication it hits, we see a higher incidence, we think, of resistance to that type of medication. So what Dr. Serna is looking at, and that's why she's interested in the relapse cases that we have, is if these cats have seen EID and both, actually all 3 of our problem children, Shorty, Beans, and Lily, all 3 of them were on EID at one point. If they have relapsed after getting EID, she's taking samples, tissue samples, to look for signs of resistance. So is it happening? Probably. Is it happening at a high instance? No. But that is why when people come in and they're like, well, I just want to give my cat GS because some doctor somewhere said they have a head tilt. This has happened a few times. They have a head tilt, there's pus pouring out of there, it must be FIP because they have a head tilt. So they're on GS, and I say, no, please stop the GS. Because like any other antimicrobial, we do not want to overuse it. We do not want to create resistance in the population. It needs to be right? Not only that, but the cat that has pus pouring out of its ears because it has ear polyp, we should probably address the ear polyp and the ear infection instead of waiting 12 weeks and then 12 more weeks before we address the actual polyp. Congratulations, I've never heard that. I love it.
Share with the class, please. Share with the class.
Oh, I will.
Oh.
So the question was, are there any physical attributes that could clue you in that your cat has FIP? And the answer is yes. And I'll give the rest of the question in a second. It is super variable. Cats are uncreative and also very creative, right? So I test the class. What things do we watch for to make sure the cat's okay? You know. Attitude, appetite, activity, and what's going on in the litter box. Jonathan, you didn't need listening class. So attitude, appetite, activity, what's going on in the litter box. So anything that looks to be wrong with them. And that's where you're going to see the changes, right? So that, and depending on the syndrome, there's some other like weird specific things. So we've had some that have come in with enlarged peripheral lymph nodes. We've had a lot of them come in that are neurological. We've had one, Magic Mike, I need to, if it's okay, right? We'll get there. Magic Mike was a kid who came in only for just not being right. He wasn't eating very well. He was kind of hanging out. He wasn't playful. He wasn't being super affectionate, which is why I named him Magic Mike. He was very amorous. Very amorous with everybody. And this foster called and said he's not. He's just not doing anything. So we kept him in the clinic for like 2 weeks. I ran every test that God has ever informed us of, spent probably $2,000 or $3,000 trying to diagnose that cat. And finally, in a fit of rage one Friday night, frustration, I said, stab the damn cat. I was so mad at him because he was just sitting in the back of the crate in ISO, not doing anything, like not doing anything. And I came in Saturday morning to do treatments for myself, and that little sack was in the front of the crate, rubbing all over the bars, had eaten every scrap of food for the first time in 3 weeks. He never had a fever, he never had abnormal blood work, and he never had any clinical signs other than lethargy and just malaise. Okay. So the actual question, which ties directly into Magic Mike, was they had a cat who had severe testicular swelling, very large man parts. And nothing worked until the cat was started on GS and poof, here. I would remove those if they haven't been removed yet. Okay. Wrong.
Well, that's what everyone's talking about.
I don't know where you go. Come visit me. Wrong. That is a huge, in my opinion, mistake. Ever since the first cat, Fantasia, my Fantasia, if a cat is doing well in treatment and they are intact, they will be spayed or neutered roughly between day 45 and 60 of treatment so that they have, hopefully, 20 plus days of treatment to continue to recover. And for females, clearly that doesn't with testicular trauma over here, that doesn't apply to them. But with females, if they are well enough to start cycling and showing estrus feed behaviors, they are well enough to get spayed. If their body has reallocated the resources to, hey, go consummate babies, they are well enough to get those parts removed, right? Fantasia, first cat we ever treated, she went in to eat at day 40-ish, and I looked at her and I was like, was it day 43? And I was like, I looked at her and I was like, oh no, we are not doing this. So she got spayed like 2 days later. And everyone in the FIP chat room was like, oh, you're going to kill her. And I was like, I don't care. Like, this is not going to work. Because heat and being an intact male also, they are huge physiological stressors. They put a tremendous physiological demand on that individual. So across the board, every single intact cat If they are well enough during treatment, they will be spayed or neutered. And I will do it when they hopefully have at least 2 weeks, ideally longer than that, of treatment remaining. And if I need to, for scheduling reasons, extend treatment, I will do that. Because I do not want that cat to have to deal with the physiological stress of being intact while they're trying to eat. Also, you have to deal with the fact that you have an intact male for at least 6 months. 3 months of treatment, 3 months of after. And you know what happens by then? They've gone through puberty and then they're like, I would like a girlfriend. And they start advertising. And we don't want them advertising in our house. Because that becomes a really...
So how do you want to
It's normal. I get there. Listen here, Johnny Scott. I do not treat them any differently. We do not address anesthesia or sedation any differently. We do not change any of the medication protocols. And I've treated over 500 cats. Of those, you know how many I had problems with? That's part of it. The other thing that comes up all the time is a couple things. Vaccines. We deal with high-risk populations. Every single kitten that comes in is going to be finish their kitten series before they finish treatment. It's separated out by a week between vaccines. Every single one of them will finish their kitten series. I had a vet out in California argue with me for several years about how that was irresponsible. And I was setting them up for vaccine or treatment failure and what have you. And then she lost a cat to panleukopenia in observation. It only took one, and then she said, you know what, maybe I was wrong. And I was like, I am so proud of you that you recognize that. Also, I'm really sorry because that fucking sucks. To put a cat through at least 3 months of stabbing and then lose it to something that is 100% preventable, okay? So every single one of our kittens, or intakes, because they're not always kittens that come in with FIP, once they are healthy enough, and that is a huge asterisk, once they are healthy enough, they get 2 December vaccinations after the age of 20 weeks, 1 rabies vaccine, and they will also get vaccinated against fetal leukemia, okay? They also get flea and tick medication. All of them get Revolution applied. A lot of people push back on that too. Revolution can cause neuroscience. So can water. I don't restrict water, and I'm serious. I'm not just being water can cause neurological signs if you drink too much of it. I don't restrict water. And there is no evidence that acetylactin interferes with GS or will contribute to morbidity or mortality. But there's a lot of evidence that fleas, ticks, ear mites will make them sick. So the only medication I do not use in a GS cat, or an FIP cat's probably more accurate, is ironically lysine. Because lysine inhibits viral replication, and that is how GS and all of those medications are supposed to work, all of those antivirals. So lysine directly, theoretically, inhibits the ability of antiviral medications to work. All of the other stuff that you see, don't use fluoroquinolones. That's a big one. People say you can't use Baytril or Veriflox or whatever in a cat that has FIP or Vax, the other one. And the answer is no, you can't. You must be reasonable and rational, right? If the cat's going to die of pneumonia, put it on what it needs, because alive is better than dead most of the time. Steroids are another I mentioned this earlier, steroids are another really big hot topic. There is the mantra across at least 80% of the public, veterinarians as well, is do not use steroids in immunocompromised cats, so cats that have FIV or fetal leukemia. How often are they? All the time. It's irrational, right? It's also do not use it in a cat that has FIP, because you're going to suppress their immune system and make it impossible for them to eliminate the virus. And I also say, children, bull honky will end that. So I say bull honky to that too, because I am rational above all things. If I have a cat that is expiring of brain swelling, I am going to put it on steroids, right? If I have a cat that has severe uveitis, I am going to put that cat on hammering doses of steroids because I want to save its eyeballs, right? If I have a cat that is chewing its skin off, I am going to put it on steroids because that's just a dick move not to, right? I want them to be comfortable, right? So my cat Fantasia, who is now six-ish, and has been cured for 5 years, right? That cat is currently on, she forgot to get this one. She is mostly on steroids, except I forgot to get this one because she has asthma and she has atopic or allergy skin disease, dermatitis, right? Within reason, and that is extremely common in our FIP pool, okay? So as after this, I'm going to be at Mustang Sally Brewery, which is right around the corner, for the plant sale. Because in my free time, I grow a crap ton of plants. I am the plants at Longstreet. It keeps me sane.